Dr. Stefano Chiaramonte highlights the importance of adequate water intake during pregnancy, which is crucial for both the mother's and the fetus well-being. This acts as a preventive measure against potential diseases and maintains optimal kidney health. Water is an essential constituent of our body, but what occurs during the phase of pregnancy?
Water is definitely a vital element in our bodies, comprising roughly 60% of body weight for males and around 50–55% for females. It is crucial to maintain adequate hydration. 60% of the water is found inside the cells, referred to as intracellular fluid, whereas the remaining 40% is located outside the cells, termed extracellular fluid. The compartments are balanced. 1/5 of extracellular fluid is in blood vessels. This is within various blood vessels. What determines the balance between the different compartments is the concentration of certain salts. These salts direct water transfer between inside and outside the cells. In particular, potassium salts are found inside the cells, while sodium salts are outside the cells. There are pathological situations where abnormal collections of water occur in certain cavities, such as the pleural cavity, the abdominal cavity, the cavity of the pericardium, and these collections of water are referred to as sequestrations. The situation inside the pregnant uterus is significantly different. It is filled with a substantial amount of water called amniotic fluid, which plays a crucial role in the development of the fetus. This fluid is actively produced by all the cells of the amniotic sac and contains essential substances such as minerals, glucose, and proteins. Initially, the amniotic fluid serves as the primary source of nourishment for the fetus. However, as the pregnancy progresses, the fetus starts actively maintaining the balance of the fluid by consuming some through swallowing and producing more through urinary secretion. Therefore, the amniotic fluid is a vital collection of liquids that greatly contributes to the well-being of the fetus and plays a critical role in maintaining the fluid balance in the pregnant woman's body.
What insights can we provide regarding blood pressure levels in pregnant women?
Of course, it must be noted first and foremost that the human body of a woman in pregnancy is an immaculate machine. It houses vital mechanisms and robust regulatory systems, all of which are intricately designed to provide crucial life support to the developing fetus. With this in mind, the maintenance of proper blood pressure levels is of utmost importance, as it ensures the provision of essential support to the conception process. When discussing hypertension, it is important to distinguish between chronic hypertension, which is elevated pressure that occurs before pregnancy, and pathological hypertension that develops generally after the 20th week during pregnancy. Chronic hypertension refers to pre-existing high blood pressure, while pathological hypertension is specific to pregnancy. The 20th week serves as a rough dividing point between the two clinical scenarios. However, it is important to understand the definition of hypertension, as the optimal blood pressure values for a pregnant woman are slightly higher in order to ensure sufficient blood and oxygen supply to the fetus and placenta. A threshold of 140/90 is considered, and when the blood pressure exceeds this value, it is classified as moderate or severe hypertension depending on the progression of the pressure readings. Maintaining the general meaning of the text while consuming more characters allows for a more detailed explanation of the concepts being discussed. This expanded version emphasizes the importance of blood pressure in pregnancy and provides more context for the classification of hypertension.
Many women complain about the appearance of edema during pregnancy. What are the causes?
Edema generally occurs when there is a pressure discrepancy between the inside of the capillary network and its surrounding area. This imbalance creates a hydraulic force, which leads to the leakage of fluids from the circulatory system, particularly affecting the capillary network. This phenomenon is a key factor in fluid retention and swelling. In the capillary network, specifically on the arterial side, there are microsphincters that control the flow of blood from arteries to capillaries. These microsphincters regulate the blood flow in response to systemic hypertension and hypotension. During systemic hypertension, the sphincter network contracts, restricting the blood flow into the capillary network. On the other hand, in conditions of hypotension, the capillary network relaxes, allowing for increased blood flow. This clarifies why there is no link between high blood pressure and the development of edema. The capillary network is also equipped with sphincters that can be found at its extremity before it connects to the venous network. However, unlike in other areas, these sphincters have a lower level of efficiency in terms of regulation. Therefore, in cases of stasis, hypertension in the venous stream can occur. In the presence of varicose conditions, this leads to elevated pressure within the capillary network, consequently increasing the risk of edema. This pertains to typical bodily functions. During pregnancy, the body experiences a range of hormonal changes that cause slight shifts in fluid distribution and affect the kidney's ability to reabsorb fluids. These alterations in hormonal production primarily impact how fluids are distributed and also influence the mechanisms through which the kidneys reabsorb fluids. Therefore, this is a slightly unique situation, which elucidates why roughly 70–75% of pregnant women experience some swelling, usually to a moderate extent, especially during the latter stages of pregnancy. Nevertheless, there exists a comprehensive explanation for this occurrence of edema. We must take into consideration that during pregnancy, there are hormonal changes which naturally lead to an increase in salt retention, equivalent to approximately 500 milliequivalents or more, as well as a physiological retention of fluids that can reach anywhere between 8 to 10 liters. These changes aim to create an optimal overall environment that supports the harmonious and natural development of the fetus.
What tips can be offered to a pregnant woman to help her avoid any potential complications?
On one hand, it is important to provide dietary guidance and note that salt intake should not be limited, ensuring a balanced approach to nutrition. Severely reducing salt intake during pregnancy can be detrimental as it causes a decline in overall salt levels. This in turn triggers regulatory mechanisms in the kidneys and adrenal glands, ultimately leading to the development and worsening of edema. The impact of insufficient salt can have lasting effects on the body during this critical time. Therefore, it is indeed a paradoxical response, albeit in a contrary manner. Furthermore, it is crucial to inform the pregnant woman about the potential risks of using diuretics for reducing edema. These medications lead to the same outcome by depleting salt reserves, which counteracts the desired effect. Therefore, it is advised that she refrains from using diuretics in order to prevent undesired consequences. In the same manner, we must emphasize the importance of maintaining a tranquil connection with water and consuming fluids in response to our body's natural thirst, avoiding excessive intake in any direction. On the other hand, pregnancy is a physiological process. It is not a disease. From the beginning with Adam and Eve, the occurrence of pregnancies has been numerous, highlighting its significance not only for women, but also for all of humanity. Thus, it is crucial to approach this event with tranquility, ensuring that neither excesses nor irrational fears overshadow its importance.